didn't look at it is in terms of the macroeconomic factors which are actually facilitating this kind of performance for the Indian healthcare sector. September 2009 forecast 12 to 15% in 2013 and 12 to 15% CAGR. But exactly in a year's time, by March 2010, the forecast got a little revised and the growth rates have further gone up from 12 to 15% to 13 to 16%. What are the key drivers for this kind of a growth change? Greater expansion of market penetration beyond the urban. I think the tier 2. Today, if you look at the pharmaceutical sector in India, tier 2 markets or the rural markets are the ones which are actually showing explosive growth. If you look at 14% growth for the Indian pharmaceutical market, the urban market, if it is growing by 10%, the rural market is growing by about 18%. So the rural, that is the tier 2, is something which today is currently shaping the Indian pharma sector. The epidemiological changes, improving diagnosis, and growing disease awareness will actually drive the demand for the chronic care. Expansion of the private hospitals into smaller towns and outreach to more diverse patient groups would actually change the landscape of the treatment patterns currently available for the Indian people. Another important change which is actually showing up is the population of the middle class. I think this population is actually greater than most of the countries excepting China. I think the middle class group, which is today actually progressing towards the upper end, is actually changing once again the lifestyle habits and leading into the explosion into the healthcare and the pharma space. Major events which would continue to drive the Indian market is greater expansion of the market. More manufacturers will make efforts to broaden their geographical coverage. As I just mentioned, the tier 2 markets are actually showing about 18% growth, which most of the companies, earlier it was predominantly the Indian companies which used to see this as an opportunity, but now even the multinationals are looking at the tier 2 as a big opportunity for themselves, and lot of efforts and lot of expansion is actually happening in these tier 2 markets, again by both Indian as well as the multinational companies which are driving forces for the Indian pharma. Probably 5 to 6 years back, the tier 2 markets are predominantly acute driven. Not much of activity was going around in terms of the patient awareness, in terms of diagnosis, in terms of treatment options available for the chronic care. But now the situation is not the same. Situation is actually reversed. The chronic care in the tier 2 markets are actually going up and exploding in a much, much bigger way. Be it hypertension, be it diabetes, be it even the neurological disorders, tier 2 markets are actually coming up in a much, much bigger way. And thanks to a lot of efforts by what Dr. Sripad Rao has mentioned in terms of the National Rural Health Mission, and also certain government initiatives which is actually putting up a lot of efforts in terms of bringing certain of these chronic diseases in control in the tier 2. In fact, places like Andhra, there are a lot of initiatives by government in terms of bringing. I'm sure that even in the Karnataka and also in the northern part, similar kind of activities are happening in terms of bringing the chronic care under control by various initiatives. Okay, when it is, malaria specific time period, a lot of initiatives are given by the government in terms of how they need to actually eradicate malaria by actually taking preventive measures. While the chronic care, it is not seasonal, so there are continuous efforts by various initiatives. A lot of NGOs are playing major role in terms of bringing the healthcare into the tier 2. There are a lot of NGOs who are actually working out on the telemedicine. I think if you look at some of the organizations like the famous Narayan Hrudayalaya in Karnataka is doing extensive work in terms of bringing the healthcare into the rural part. Even with respect to addressing certain early stages of cancer. Some of these initiatives by a lot of major corporates are actually working towards that. That is facilitating the market penetration. Companies today are trying to shape their portfolios to address the needs of various emerging diseases. Earlier, companies were trying to focus and only look at portfolios which are actually addressing to the current need. Companies are not the multinationals, but even the Indian companies or the local companies are trying to shape up the portfolio where looking at what are those emerging diseases and how one should look at portfolios addressing to those needs, either by NCEs or with some kind of a differentiated formulations to again meet the needs of the population in these markets. What are the implications of the multinationals and local companies? I think the multinationals are slowly moving as the local companies in the Indian space. Local companies are actually turning towards the multinationals in terms of looking at how they can be creative and innovative in terms of bringing in the right kind of portfolio and right kind of healthcare need for the Indian market. We have actually discussed in depth earlier also in terms of the aging group, which is actually fast catching up, and that is actually bringing up the need for the Indian pharmaceutical sector to look at the chronic care therapy much more in detail. Lifestyle changes and the rising income is actually leading in terms of rise of the chronic care and the rise of certain non-communicable diseases, what is presented earlier. Rising demand for the chronic drugs will actually fuel the growth for the pharmaceutical market. Today, with the Indian pharmaceutical market is at 60,000 crores or 18 billion, what has been actually shown, 75% market is of the acute care portfolio, 25% is of chronic care. Going forward, it is actually projected that this market will slowly move to 70-30, and by 2015 it would actually go as 60% towards the acute care portfolio and 40% towards the chronic care portfolio, because we already are aware that India is becoming or already became capital for hypertension, capital for diabetes. So I think even the healthcare sector, the pharmaceutical sector is slowly getting poised towards that kind of a shift happening, and the portfolio alignment of these companies are actually addressing towards that need. There are lots of small companies which started about 15 years back in the Indian space with only few portfolio addressing to the acute care. Today, they have their portfolio across all the value chain in the Indian pharmaceutical space. Gradual increase in the government healthcare expenditure. I think that is again thanks to a lot of initiatives like Arogya Shri in certain parts of the country, which is addressing even the chronic care to the major extent. Most of the hospitalization for even not for the urban and then high-end kind of lifestyle people, but for the economically poor class of group, Arogya Shri is actually giving them the right kind of impetus for the chronic care treatment, which is actually government funded, other than the National Rural Health Mission and Rajiv Arogya Mission, which is there as a part of the overall government plan addressing the healthcare in the rural need. Not to mention about the private sector hospitalization and a lot of corporate hospitals, which were actually probably 10 years back, we haven't witnessed much of that kind of noise around in terms of the private hospitals. But last 10 years, you could see lots of private hospitals coming up in a big way. The corporate hospitals are coming up not only in the tier 1 kind of cities, but slowly they are moving into the tier 2. Business models differ. You cannot expect an Apollo to actually come and actually operate in a smaller place like that of a Mangalore. But they have their business model, which is more in terms of a franchisee, but still the need is they are trying to address the healthcare need, and the private hospitals are fast catching up. Rising patient incomes, growth of the private health insurance and the emergence of larger market for medical tourism, all these are actually facilitating the healthcare spend and also the private hospitals coming in a big way in the Indian healthcare space. Others are catering for patients outside the core group of high earners that have traditionally dominated the private healthcare market. This is something which I thought probably I would use this platform to actually talk about how the Indian market is shaping up and where it is today and what it is going to be going forward. Having said all these things, I don't think you need to have even an iota of doubt in terms of what opportunities you have in the healthcare space. Having looked at the Indian pharmaceutical market actually going up in a very big way, do we really need to think through in terms of what kind of opportunities we have? Do we need to think through? Yes? Okay. Then I want someone to help me. There is another presentation there. I would like to just quickly touch upon from Dr. Reddy's perspective, since the group felt that you need to know the need of opportunities for the healthcare professionals in the pharmaceutical sector. This small slide, which actually talks about how the corporates are looking at the healthcare professionals in various spaces. So let me just touch upon 4 broad areas. In terms of the management hires, we are trying to look at management hires into the marketing, in terms of finance, in terms of human resources. When it comes to marketing, no need to mention that the healthcare professionals, the healthcare management students would actually getting into areas of either the marketing or in the sales or in the business development or in the alliance management or in the brand management. In the finance, we actually look at the corporate analytics and the consolidation. The human resources, no need to mention the recruitment and the learning and development. As an organization, we actually offer positions at the entry level and also the laterals. 40% of the management trainees are actually joined through the pre-placement offers, and since we are a global organization, we do actually provide opportunities for the management students not only in India but also in our overseas locations. Just go back. And probably you can look at the technical trainees. While we are talking about the opportunities for the sales and marketing from the marketing function, we do also need people in the various back-end sectors. So if we look at engineering, we look at manufacturing, technical services, engineering services, safety, health and environment from the engineering part of it. From pharmaceutical sciences, we look at the basic research, clinical development, production, quality assurance and regulatory. We do also have good number of medical doctors. I could see the hostess of this event is a medical doctor by herself. So we do look at the doctors in the clinical development, clinical trials, corporate medical services and medical marketing. Broadly we take them and then induct them to enhance the technical skills and knowledge, and this is primarily to provide an opportunity to work with eminent chemists, biologists and scientists, both in terms of development and also the taking the markets for commercialization. You can look at the legal. So no pharmaceutical company can actually go without legal expertise. So we do also look for the legal experts, which would actually be looking at primarily the mergers and acquisitions, the alliances, and then the business partnerships and the collaborative agreements. So we look at opportunities to deal with laws of various countries. Since we operate in various geographies, we do also require legal experts who understand the legal formalities of various countries, because no two countries have the same kind of legal formalities. So the US and Europe, China might have a completely different one from that of a Latin America or a Middle East or an Indian law. So they are going to be part of the legal strategy and implementation, and they are going to be the business partners at a very young age. I don't know how many of you are actually having a background of law. And then finally, we'll try and look at the chartered accountants. I don't know again, this group whether they have the chartered accountants inside, but chartered accountants, we provide opportunity to be a part of the globally diversified business, and our chartered accountants spearhead various functions in the accounting, taxation, treasury, investor relations, analytics, corporate and business functions, and the mergers and acquisitions. So everywhere, I think the chartered accountants, the legal professionals, along with the business development, work together, because it's again different domain expertise fall in to have any deal successful be. Lastly, I think we also hire the global interns, but I don't know whether it is specific to this group, but this is again across various functions, but these are hired from the management schools abroad. So, any questions you have?
What does it mean in terms of OTC drugs, which is a big market now? So how do you see that going forward over the years?
Okay. The question posed to me is in terms of how the OTC market is going to shape up in India. Today, the statistics show 9 to 10% of the market is OTC, and the rest is all prescription based. If you look at the trends over the last few years, OTC is one which is actually mimicking the developed countries, and we are seeing a lot of products, especially the pre and probiotics, which were not so being used in India, has now got itself a prominent place. While no need to mention about the analgesics and other common OTC preparations, but OTC is more turning towards the cosmeceuticals than the pre and probiotics, and lots of other formulations are getting into OTC. Lot of companies, if you look at the top 10 Indian pharma companies, earlier only 1 or 2 used to have their OTC spread. But today, all the 10 companies have their OTC business. And that only can tell us that moving forward, OTC as a business sector is going to have a phenomenal place in the Indian pharma space, and lots of drugs would slowly actually get from normally what we term as a self-use into an OTC, provided the regulations actually facilitate that. Because I think most of you know, OTC drugs per se requires to be under a particular schedule, which are called as Schedule Schedule K. So unless they fall under the Schedule K formulations, I don't think the companies can actually take the products into OTCs.
So how does Dr. Reddy's laboratories deal with the R&D cliff, especially when the key products get off patent?
Okay. Why only Dr. Reddy's? I think that's a challenge for the entire Indian pharma and also for the global pharma. But that is more, taken it from a positive frame of mind, and it's also looked at as an opportunity, because more and more genericization, it is more the benefit for the generic players, which Dr. Reddy's belongs to, because most of the Indian companies doesn't have NCEs in their pocket. So in that backdrop, I think loss of patent status in the global markets are actually opportunity areas for the generic players, not only in the global space but also in the Indian space. And I can only tell you that that is only going to open up avenues and opportunities for lots of generic players, including Dr. Reddy's.
Good morning, sir. I am Dr. Ashwin Patil. I am pursuing here a Master of the Public Health, and I would like to ask one question, that what is the role of the epidemiologist or the biostatistician in the pharmaceutical company? As you mentioned about the epidemiological trend change, so how the diseases are changing from the infectious to the non-infectious, chronic and the degenerative diseases, and according to that you are changing your strategy and all that. This is my first question. And second question, that our main goal or the objective of the Ministry of the Health and Family Welfare is that to reduce the IMR and MMR and to reduce the burden of the communicable, non-communicable diseases. So as a corporate social responsibility, what is the role of this pharmaceutical company to reduce the burden, and how they are how they are helping this department to reduce this burden apart from the production and the distribution of the medicines. That is my question.
I'll take your first question in terms of role of epidemiologist in pharmaceutical space. Frankly speaking, the role of epidemiologist hasn't really evolved in the pharmaceutical sector as yet. Reason simple, because that is mostly actually driven from the government in terms of actually making the corporates to understand about the epidemiological trends, and it is actually the baton is actually taken up from the epidemiologists to the corporate world. But if you look at the medical doctors and its role in the pharmaceutical area, we do have people working out in the medical services in terms of the clinical trials and in terms of drug development. I am not able to really comment in terms of where epidemiologist currently actually comes in these three specific areas. Okay, and question number 2 in terms of corporate social responsibility. Lot of corporates, including our organization, works in terms of two basic areas in terms of awareness and diagnosis. Okay, these are the two areas when I am talking about the tier 2, and which we have done extensive work which we have been doing for the last 2 years in terms of actually getting into the tier 2, that is the villages which are less than 10,000 population, and try and understand actually not only the population group but also the doctor group there in terms of providing them the proper medical education in terms of the emerging diseases. So there are different platforms we use in terms of airing the experts and their views on treatment patterns to these doctors in the rural spaces. And for the patients, what we try to look at is we have actually chosen certain common diseases like management of anemia.
Thank you, sir, for the valuable lecture. I now request Professor Rishi Keshav Ram to present a memento to a guest, Dr. P. Ratnakar. Mrs. Kidyur is Cognizant's Senior Vice President of the Health Practice, responsible for overall client delivery of engagements of healthcare payers, PBMs, providers, intermediaries, etc. She has over 22 years of experience in global IT companies, with her experience spanning key functions such as offshore delivery management, competency development, practice building, and business development. Her innate ability to build and foster collaborative working relationships with key business units and clients has enabled high-quality delivery across a varied spectrum of service offerings of Cognizant. I would request Mrs. Vinay Ambika Kidyur to come up on the stage and enlighten us on the topic, role of IT consulting in healthcare and opportunities for healthcare professionals.
Good afternoon, everybody. Thank you for giving me this opportunity to come and speak to you on maybe a different topic on healthcare. Unlike what Dr. Shripati Rao or Dr. Ratnakar spoke, well deep into that subject, we pretty much operate across the entire spectrum of healthcare, especially in the IT area. It's very heartening to see that we have so many students in the HCM space here in TAPMI. Welcome aboard into this profession. I look forward to seeing you all in similar institutions as us, literally being able to dive deep into this space and make sense, a little bit more sense than what we are today being able to do. So I have we realize that I think Mohan and I are between you and lunch. So we're kind of trying to make up some time today. So I've just laid out this agenda. Maybe I'll make it quick so that we can open it up more for questions which you might have of us. The healthcare ecosystem, I thought I'm sure you all know about it, but let me just recap for those of you who are probably just getting initiated into it. Drivers of healthcare information technology, literally what are the drivers that we see across the spectrum? The healthcare IT evolution as we see it, as how we have mapped it across a couple of axes that we are looking at. The benefits that I see is a picture, that nice picture that I managed to pull out from somewhere. The challenges that we see today in the healthcare IT space, and of course, the opportunities for you as well as us in leveraging you in this space. The ecosystem, as you see, is comprised of multiple stakeholders, multiple touch points, very diverse area of interest for each of these players. Obviously, it means that there are a lot of opportunities of integration between each of the players here. A patient, a member in an insurance term, a patient from a doctor's perspective, all of them have multiple touch points, as you see in this picture. And each one, obviously it's not clockwise or anti-clockwise or sequential in the way you can read this picture. They interact with each other in many ways. And that gives the opportunity for us literally to enhance the IT or enhance the capabilities of those interactions through information technology or through systems and applications and products that we can implement to enable those interactions better. So typically you will see that you have hospitals and labs, and that's something that is very important in this spectrum. What is probably not really common, labs, hospitals, doctors, I think are very common, but in this industry, the payer industry, as I would call it, the insurance industry is not something that is very familiar, because in India, as we see, and we heard from Dr. Ratnakar as well, we have very few people who are actually insured. There's a lot more self-pay that is happening, a lot more out-of-pocket, as Dr. Sripati Rao also said, that we see. But insurance is a very big term that we'll have to learn, because that's the market, that's what is trending towards, especially in the private area, and corporates literally using that as a good benefit to attract employees, giving them good health coverage through this insurance that can be given to the employees. So that's one. And of course government. Government is something that is we have seen as a very big stakeholder in the whole ecosystem. Be it literally the Dr. Bohr, Joseph Bohr thing that Dr. Sripati Rao mentioned, or today's world where you have regulatory agencies like IRDA or the National Rural Health Mission as we speak. So coming pretty much heavily on the whole system in terms of regulating this whole industry, making sure that the interactions, the whole industry itself, the business is regulated and makes sense, and also ensure that there is access and availability of care for all the people that are required. I'm not just talking about India, but also across the world, where government literally flexes its muscle in making sure that the standards are adhered to. There is also cost of care that is getting is actually going out of proportion as we speak, but trying to see if they can contain that, and making sure that everybody, each and every citizen of each country actually is able to access care and get good care delivery on each of their requirements. Of course, pharma companies, Dr. Ratnakar, I thought, gave a beautiful